So this seventh document of tissue disorder, it has the discussion regarding disorders of sexual differentiation. These disorders of sexual differentiation, they are complex this type of disorders and involve a range of individual chromosomal, enzyme and hormone receptor defects. The defects may be obvious and severe at birth, and they may be subtle, presenting with infertility later in life. These are congenital conditions in which development of chromosomal, gonadal or anatomical sex is atypical. All the disorders of sexual differentiation that we are going to discuss in this document, so the first disorder is 47XXY females, and there are cases of 47XXY females. In some cases of this condition, SRY, sex determining region on Y chromosome, this region or androgen receptor abnormalities are detected. जो बेसिक प्रॉब्लम है 47XXY फीमेल्स नाम से ही जाहिर है, जो टोटल क्रोमोसोमल नंबर है वो 47 है विद वन एडिशनल सेक्स क्रोमोसोम. यूजुअली ह्यूमन कैरियोटाइप है 46XY और 46XX फॉर फीमेल्स. बट यहाँ पर जो पिक्चर हमें नज़र आ रही है वो है 47XXY फीमेल्स, और जो बेसिक डिसऑर्डर है वो है SRY जीन, सेक्स डिटर्मिनिंग रीजन, जो कि मौजूद है Y क्रोमोसोम पे. ये जो है 47XXY फीमेल फिनोटाइप के साथ है. एक और कंडीशन है 47XXY मेल फिनोटाइप के साथ, जिनकी जनरल अपीयरेंस मेल है, बट कंडीशन जो है वो 47XXY है, and this is termed as Klinefelter syndrome. ये जो SRY जीन है, sex determining gene, sex determining region on Y chromosome, is the major gene necessary to induce the undifferentiated bipotential gonadal primordium to develop as testis. So testicular development के लिए प्रॉपर फंक्शनिंग SRY रीजन की इम्पॉर्टेंट है. Recently, several SRY box related genes have also been identified on autosomes, and mutations in both SRY or sometime in SOX genes have been implicated in sex reversal. Next condition is 5-alpha reductase deficiency, also known as 5-ARD. It is an autosomal recessive condition caused by the mutation of 5-alpha reductase type 2 genes. It only affects people with Y chromosomes, namely genetic males. People with this condition are fertile with the ability to produce children, but may be raised as females due to ambiguous or feminized genitalia. Another disorder of sex differentiation is androgen insensitivity syndrome, also known as or abbreviated as AIS, androgen insensitivity syndrome. It is a condition which affects a genetic male virilization. A person with androgen insensitivity syndrome produces androgens and testosterone, but their body does not recognize them, either partially or completely. Mild androgen insensitivity syndrome generally causes no developmental issues, and people with this form are raised as males. Partial androgen insensitivity syndrome results in ambiguous genitalia, and there is no consensus regarding whether to raise a children with this form as male or female. Complete androgen insensitivity syndrome causes a genetic male to have a vagina, breasts, and a clitoris, and people with this form are raised as females. The next one is aphalia, a rare occurrence where a male is born without a penis or where a female is born without a clitoris. And in 2005, in the year 2005, only 75 cases of aphalia have been documented. The next one is congenital adrenal hyperplasia, also known as or abbreviated as CAH. It is a condition that causes excessive androgen production, which causes excessive virilization. It is most problematic in genetic females, where severe virilization can result in vaginal agenesis or absence of vagina. Females with this condition are usually fertile with the ability to become pregnant and can give birth. The next one is XX male syndrome, a condition where a genetically female 46XX individual is phenotypically male, usually caused by atypical chromosomal crossover of the Y chromosome's SRY gene. XX males are shorter and weigh less than XY males. They may have genital ambiguities, usually have small testes, and are universally sterile. The next one is gonadal dysgenesis, is any congenital developmental disorder of the reproductive system characterized by progressive loss of primordial germ cells on the developing gonads of an embryo. Klinefelter syndrome, जैसे अभी हमने ऊपर देखा 47XXY female, also known as 47XXY and XXY syndrome, a condition that describes a male born with at least one extra X chromosome. Though the most common variation is 47XXY, a man may also be 48 triple XY or 49 XXXXY. It is a common occurrence affecting 1 in 500 to 1,000 males. While some men may have no issues related to the syndrome, some may experience gynecomastia, micropenis, cognitive difficulties, hypogonadism, reduced fertility or infertility in some cases, and or little or no facial hair. Testosterone therapy may be pursued to have a more masculine appearance. Next one is Leydig cell hypoplasia. Leydig cell hypoplasia is a condition that affects male sexual development. It is characterized by underdevelopment of Leydig cells in testes. Leydig cells secrete male sex hormones that are important for normal male sexual development before birth and during puberty. Patients may present at birth with a fully female phenotype, ambiguous genitalia, or only mild genital defects, such as micropenis and hypospadias. Upon puberty, sexual development is either impaired or fully absent. Next one is Turner syndrome, also known as Turner syndrome or gonadal dysgenesis. A condition that describes a female born with only one X chromosome or with an abnormal X chromosome, making her karyotype 45XO. It occurs in 1 in 2,000 to 5,000 females. Turner syndrome causes numerous health and developmental problems, including but not limited to short stature, lymphedema, infertility, webbed neck, coarctation of the aorta, ADHD, amenorrhea, and obesity. Cleft palate and the related cleft lip are relatively common, about 1 per thousand births. Approximately 20% of the children with these disorders have associated major malformations. The important stages of development of the lips, palate, nose, and jaws occur in the first 9 weeks of embryonic life. From about 5 weeks of gestational age, the maxillary processes grow anteriorly and medially and fuse with the developing frontonasal process at 2 points just below the nostrils, forming the upper lip. Meanwhile, the palate develops from the palatal processes of the maxillary processes, which grow medially to fuse with the nasal septum in the midline at about 9 weeks. Usually, a split or cleft in the lip or palate is immediately identifiable at birth. Cleft lip and cleft palate may appear as a split in the lip and roof of the mouth that affects one or both sides of the face. Less commonly, a cleft occurs only in the muscles of the soft palate, which are at the back of the mouth and covered by the mouth's lining. This type of cleft often goes unnoticed at birth and may not be diagnosed until later when signs develop. Signs and symptoms of submucous cleft palate may include difficulty with feeding, difficulty swallowing, with potential for liquids or foods to come out of the nose, nasal speaking voices, chronic ear infections. Several factors may increase the likelihood of a baby developing a cleft lip and cleft palate, including family history of the parent, exposure to certain substances during pregnancy, for example, cigarette smoke, alcohol, or with certain medications, having diabetes. There is some evidence that females diagnosed with diabetes before pregnancy may have an increased risk of having a baby with a cleft lip, with or without a cleft palate. And the last one is being obese during pregnancy. There is some evidence that babies born to obese females may have increased risk of cleft lip and palate. Males are more likely to have a cleft lip with or without cleft palate. Cleft palate without cleft lip is more common in females.